I'm Elliot Antman, president of the American Heart Association. Make sure you plan to stay in Chicago through Wednesday because you don't want to miss late-breaking clinical trial session number 4.
Late-breaking clinical trial session 4 is about ischemic heart disease. This is what we have to do, take care of these patients, and we're going to learn a lot in this session that we can take home immediately and be better clinicians for our patients.
And there are other sessions too. There's one session, a late-breaking clinical trial session, focused entirely on percutaneous coronary revascularization, focusing on stent technologies, different stent technologies, new kinds of bare metal stents that may stay patent longer, contemporary drug-eluting stents, and then stents that are bioabsorbable. We need to have these kind of head-to-head studies, so stay tuned. It's going to be some great information, probably the most robust portfolio of late-breaking clinical trials we've ever seen, and importantly, clinical trials that matter. These won't be just, oh, by the way, sort of observations or footnote studies. These will be studies that potentially can change the way we practice medicine the next day.
There's a third trial that I'm really looking forward to hearing about, and that is whether using oxygen for patients who are having a myocardial infarction is better than having them breathe room air. There's some exciting basic research that suggests oxygen might not be the right thing to do. This trial will help us solve this problem that all of us face every day.
Well, I think that's an intriguing question. We've always kind of assumed that oxygen is good for you, can't be bad for you, but do we need it? So this trial, I think, will be of great interest because that clearly could be practice changing if we find that oxygen makes no difference at all in our patients. And then finally, there's going to be important data coming out of the STEMI Accelerate trial from Mission Lifeline, taking the Mission Lifeline program from the American Heart Association, rolling this out in a community, in communities to determine whether one can lead to better outcomes for our patients using the Mission Lifeline program. So I think this combination of bioabsorbable stents, oxygen for myocardial infarction, and strategies to improve outcomes in patients with myocardial infarction will be of great interest for all of us who see patients day in and day out with coronary disease.